Hi, I'm Chris Carmichael. I'm a former professional athlete, cyclist. I raced in all the major competitions around the world, including the Tour de France, and I'm an Olympian. I'm also a coach. I was U.S. Olympic Committee Coach of the Year. Anyway, I've been intrigued with CBD and potentially the importance that it can help athletes, whether it's from improving sleep or pain relief or things along those lines. And so I decided, let's get the best in the business together. And I'm going to kick off with my first question to Dr. Kogan. Many of us have heard of CBD, but tell us the difference between CBD and CBDA.
Yeah, let me give you just a second of background so that your listeners can sort of grasp what I do. So I'm an associate professor of medicine at George Washington University and medical director of GW Center for Integrative Medicine. And most of what I do in day-to-day life, I take care of really sick people. I'm also a geriatrician and a palliative care doctor. So I've worked primarily with patients who have multiple different concerns, chronic problems, and I got into cannabinoid field in 2011 after I met Dr. Abrams, and sort of he became my mentor pretty quickly. And as the District of Columbia passed the law and distribution started into 2011, 2012, I sort of been since engaged. And I think my main reason to sort of early get into CBDA probably was 6 or 7 years ago was when I started realizing that we needed a non-toxic pain control that could be delivered in not only oral, but topical, rectal, different sublingual, of course. And so I kind of started trying different things, working with different kind of coaches and obtaining different products, and very quickly realized that CBDA actually was more potent for certain conditions than CBD. And so the difference between the two molecules is actually quite specific and quite simple. So the CBDA, or acid, goes to cannabidiolic acid, is a or the form that needs to get decarboxylated to get CBD. So in essence, the actual live cannabis or hemp plant contains CBDA, and then when you extract the CBDA and you can convert it to the CBD, so it's basically a more original product. In botanical terms, we actually kind of say the original, the first molecule in the plant in some ways actually more important because it's sort of precursor to whatever else you can make with it. So that's a biological difference in terms of the actual molecular structure, and I'm sure Stacy can say a lot more about that. I'm not a researcher or manufacturer. I just use the compounds for my patients, and that's what I know. And but the difference biologically in terms of clinical application is huge. I mean, I would say that these molecules are just as different as CBD and THC in a certain way. I mean, there's some similarities, which we'll discuss in a second, but they are very different. It's really difficult to get that in dispensaries. Quite often in dispensaries, they don't even know main applications of CBDA. So I think when I got introduced to Stacy, and that actually was quite helpful because, it's a very high grade and quite concentrated product.
Thank you, Doctor. Well, my main interest in CBDA is for athletes. And so could you give us your thoughts on how CBDA can help an athlete from a performance standpoint and also a recovery standpoint?
So I think the easiest way to describe CBDA, and that's what I often tell to my patients, think of CBDA as your Motrin, except that the difference are Advil or ibuprofen, whatever you prefer in terms of non-steroidals, anti-inflammatories. Except that think of your non-steroidal being 10 times more potent and 10 times safer. So that's kind of how I want my patients to think about CBDA. And the reason is very simple. So as I said, I'm a geriatrician, so I have a lot of patients on multiple medications with multiple comorbidities. So I almost never prescribe NSAIDs. I probably can't even remember when I did that. And the reason is they're very dangerous drugs. Their list of side effects is probably several pages. They can kill people quickly. We know that even a single dose of any NSAID causes immediate problems. They cause what's called perforations in intestinal lining, even from one dose. Now, usually those perforations heal instantaneously. You don't have to worry from taking few pills. The problem begins when you get to take those medications on a continuous basis. And those problems can be at any age, for any person, no matter how healthy, Chris, your athletes are. I would say there's really no reason to use NSAIDs unless you have done other things first. And to me, the CBDA would be the first line to do, because the sort of the core clinical and base research or baseline biological research is pretty clear. CBDA anti-inflammatory effects are pretty potent. Now, unfortunately, we don't have enough clinical studies to say compare side by side effect of Motrin versus the CBDA, but I'm sure eventually that will happen. But to me, I've done enough of this in clinical practice to know that effects are real. They're very dose dependent, and they seem to be predictable, which is really important. It means that, let's say your athlete has a micro trauma and they need to heal very quickly, and you're concerned that if you give them an NSAID, you're going to give them some side effect, right? So this is the case where use of CBD as a first line is actually very appropriate, because as long as you're not really risking some more significant problem and you have time on your hand to try it and you know it's going to be safer, that's the sort of the perfect way of utilization. And I would say that's probably the primary use. And when you talk about inflammation, you talk about three things, right? You talk about sort of swelling of the tissues, a redness of the tissues, and the pain in the tissue, right? So that's a kind of classic inflammatory response. And since we're talking more about athletes, we're really talking about a trauma either from the overuse or from a micro injury or from real injury, right? So that's a majority of or significant proportion of what needs to be addressed. And, you know, for that, I would say the reason CBDA can shine is because you can use it in different way. Let's say you have a really small trauma on the skin, for example. Well, you can put it topically right over it. And in my experience, it often works really well and very fast, and you're actually avoiding putting anything internally completely. You know, if somebody has a really significant post-exercise a soreness, you can use higher doses systemically and they will work. And I actually find every time I would use it with my patients, I see a pretty similar effect as I would use NSAIDs in the past, you know, decades ago or whatever. So to me, that's the main application. And I don't know if Stacy, if you want to add anything, if your other providers that work with you have been telling you other things.
No, you're consistent with what we have seen. And I just wanted to add, I had a friend that had, we had run a marathon together, and afterwards he had complete renal failure because of the ibuprofen he was taking. And it actually didn't come back, and he ended up getting a kidney transplant, and he was in his 30s. So those, you know, that's a pretty glaring side effect, but it is very real. I notice for myself, like when you're talking about joint and tissue swelling, I'll notice my knees swell after a hard workout, after a long ride or something. And that's where I love our topical muscle rub. So it's a higher concentration, you get it exactly where you need. And I notice it in just a few minutes. And so that was the idea behind creating those products. It's just finding an alternative to NSAIDs, and that COX-2 inhibition from CBDA is key. And that's something we don't see with CBD. So that's a pretty unique distinction.
Well, there's also really important other points. So again, that's why I love CBDA is that it doesn't have as many interactions with medications as CBD does. And unfortunately, this whole CBD interaction train is misunderstood a bit, unfortunately, because most of the consumers who take CBD in the whopping doses are younger patients. And I can assure you that with the time, we're going to start seeing problems. It's just a matter of time. I already seen overdoses of opiates combined with CBD on several patients. So it's just a matter of time we're going to start seeing this. You know, I don't really scream loudly about this topic on every corner, mostly because I don't want to step on anybody's toes, so to speak. But I I get the patients who are the most frail. And so that's where the side effects come out first. And so my priority always is start with something the safest, and and CBD actually way safer than CBD, in my opinion, because of the lack of interactions or major interactions with medications. But Stacy, since you talked about the marathon, so my father is 85, he's an elite marathon runner. He's usually in the top 3 in Philadelphia Marathon for past 20 years. And
Nice.
he's never used a single dose of Motrin in his life. Well,
Wow.
in the last 10 years since I got introduced into the cannabinoid world. So he's has a pretty complex cocktail of things that he takes whenever he has any. And by the way, that's another. He's very rigid in his ways, so certain things to get through to him is a little challenging. So he still runs in those $20 sneakers, and somehow with all the right nutrients and CBD, CBDa in mix for different times for different things, he hasn't been really hurt and still running at 85.
Great. You got a few more years, Chris.
Well, now.
Keep riding those big mountains.
Well, with CBDA, it's extracted from the hemp plant. CBDA with water extraction versus CBD, where they use ethanol or CO2. What's the difference, and how should we be concerned about that?
Well, as Dr. Kogan mentioned earlier, CBDA is the cannabinoid that's made most prominently in the cannabis plant, in the hemp plant. The other methods of extraction use heat, and heat causes a chemical process called decarboxylation, where a carboxyl group gets molecularly changed and it gets converted into CBD. Even without temperature, so even when they do extraction with cold ethanol, the presence of the ethanol alcohol does cause a decarboxylation reaction starting immediately. So because it's a protic solution and the solvents used, it does cause the decarb. So the reputation, I guess, in the industry is that you can't extract CBDA, that it's not stable. Well, we found a way to do it with water, and it is stable. So we've been extracting for over 2 years now, and we still have the powder from the original extraction 2 years ago, and it's still perfectly stable in CBDA. And then we took it a step further and made it into the finished product so that people could try those, and that's even more stable. And like I said, it stays in the CBDA form and doesn't convert unless it's in the presence of heat or the ethanol. That matters because the ethanol over time is not great for our bodies. And Dr. Kogan could probably speak more to that. But the presence of those solvents does cause problems. And there was a big study years ago that showed CBD toxicity. But in kind of re-examining that study, it had really high levels of hexane. So it was more likely the hexane that caused the liver damage than the cannabis itself. And so the presence of those solvents, especially in the end product, when you're taking this every day, it gets concentrated and it's not good for our bodies. The CO2 uses high pressure. And so if you look under a bioassay, which is a type of microscope that biologists use to look at like the potency or the kind of activity of a live molecule, it's far higher with the water extracted than it is with solvents or CO2, because it's just a more raw, natural way. So we keep it in kind of that natural state that it's made. It's just less messed around with. And I don't ever talk bad about any other methods, or those are definitely the most prominent methods of extraction, but I'm just so honored that we found a better way to do it.
Stacey, I always wondered, there's sort of like a silos in an industry. So there are small companies that do really good with certain things. And it's a more of a philosophical question for me as a practitioner. Where do you think it's all going? Because my concern is, I can give patients 3 different artesian excellent products, including yours, but I really want to have some simplified process here, because it's hard to order things from different places and stuff. how is this going to get consolidated? And, I'm not obviously, I'm sure you don't know, but I'm just curious your thought process. Where are we going?
I wish I knew exactly, but my thinking and kind of keeping my finger on the pulse of the industry is that we will get to a place, and I think we're already getting there, where we can pull out specific cannabinoids for specific issues. So CBN is one that's very popular for sleep. So if you need help with sleep, maybe you take a full spectrum, but you add a little extra CBN for that specific condition. So I see us going in that direction a little bit. There are still kind of the overwhelming studies and thoughts on entourage effect, that the presence of all the cannabinoids together work in a synergistic way, and in concert, they're better than the individual pieces. But I do think for certain conditions, we will see individual cannabinoid molecules pulled out and kind of dosed, like a compound pharmacy.
Yeah, that's where I was going. I mean, I kind of wonder if eventually we can have a system where it would be like a compounding pharmacy. I call my compounder and say, hey, I want this for my patient. I mean,
we're already starting to do some of that. Yeah.
Oh, good. Yeah, that's excellent. So I hope that, once we get the whole Schedule 1 issue under removed, that this is going to be the future, because clearly the potential here is huge.
Well, a question that I get often from athletes when I recommend using CBDA is perhaps the very first thing they ask is, well, am I going to come up positive on a doping control test? THC is a banned substance for in-competition drug control tests. And so just want to kind of clarify and hear your thoughts, Dr. Hogan and Stacy, on whether any of these athletes, if they're taking CBD, would somehow flag a doping control test.
Well, I think it's a critical question. It also goes to a point where, I have a lot of my patients who work for governments, so that's kind of the same issue. So there's a zero tolerance policy, so they can say whatever they want, but if the test turns out positive and they say, look, I never took THC, I only took CBD or CBDA, the government won't care, they'll get fired. It's not actually an easy question. I'll try to answer it in a sort of two different ways. So one is, if the product that your athlete is taking is not very good quality, meaning that there's a traces of THC higher than 0.3% or even at 0.3% that are in, whether it's CBD or CBDA or anything for that matter, even derived from hemp, the test could be positive. And I actually have seen that. And moreover, I even was involved in several legal cases as an expert providing the sort of defense against the accusations. So that definitely is possible. Now, the question always comes up in different circles. Can the CBD or CBDA be converted to THC in an acidity of a stomach, for example? And I think the answer to that is no. I don't think there's any real clear evidence. So I think if you have a product that you're starting with that's extremely clean and it's just the pure and the amount of THC there is negligent, I think it's relatively safe. But I still give warning to all of my patients, because in reality, it's actually not so simple to create an exceedingly pure solution when the THC is less than such a threshold that it will not show up on a test. It also obviously depends how much someone is taking, right? So if they're using it topically, there is a systemic absorption, of course, but it's much, much less. So you're probably not going to get to any significant levels. However, if you take a massive oral doses, that even very clean product with a very small amount of THC could actually turn the urine positive. And I'm sure Stacy has something to add to this.
There were some, I think they're used less now, but there were some older testing methods that was not directly detecting THC, but a downstream metabolite. And some of those metabolites could be similar between the different cannabinoids. So that was something that had kind of come up before. Anecdotally, I did this to myself. I bought a bunch of kits at Walgreens, the kind of cheap at-home THC test. I'm not a THC consumer. I do take a lot of our CBDA, and I was taking pretty big doses just to kind of test, and it never came up positive. So I haven't seen that yet with ours. I always give a little disclaimer, kind of like you did, like it's possible. Our THC, actually, we don't have any THC or any of the Delta 9 in our products at all. There's trace amounts of THCA, and most of them are even non-detect levels in the final products. And then topically, I think there's an incredibly slim chance.
So Stacy, the THC, will the regular tests, especially the one that police does, will they pick up THCA or will they not?
Most don't, but there's a possibility that it could. So it depends on how specific the tests are. I think they're getting better with testing because there were a couple of big lawsuits where, you know, the police even transporting the hemp plants, they're like, well, it smells like marijuana. It does. Yeah, it's the same plant. So they've gotten a little better with the testing methods. I think if I was an elite athlete and I came up positive, I would probably demand another test or a more specific kind of test. But I feel comfortable saying our topical products, they're not going to show up positive.
I'll also add that it's only a controlled substance for in competition testing, not out of competition testing. So the athletes that I work with, endurance athletes, you know, using a product that has THC in it for during competition would not be a performance enhancer. I wouldn't think that they would. I've never seen any claims or studies that say THC is a performance enhancer for any sort of aerobic activity or aerobic sport competition.
Well, I would add, to me, that would be insane because THC and anandamide are essentially nearly identical molecules. I mean, sure, they're structurally somewhat different, but the way they operate in the body is the same. So can any athlete or can any company controlling this process claim that this is boosting anandamide naturally? How could that be sort of any kind of doping? So I'm just curious, why did anybody think that cannabinoids can be doping substance? Like how did that came up?
I think there's some feelings for like sports like shooting, Olympic shooting, archery, some sports that are really skill-driven sports. There's a feeling that THC can give a better focus for these athletes. And whether that is backed up by any sort of research that support those claims, I'm not aware of that. But for endurance sports, I don't think I'm not aware of any athletes or anybody that would want to use a product that has THC in it for performance enhancement for a competition. I think where the endurance athletes get concerned is not if they're using it out of competition and it has THC in it and it has enough that stays in the body and drags into a competition and they get tested and that they're above the level of THC, that's where they get.
Well, that's the problem, right?
Yeah.
Because majority of current tests do not do the quantitative analysis. It's just plus minus. It's fascinating topic. I love the legal stuff around this. It's so hypocritical and so crazy. It reminds me of the Russia where I grew up. Nobody has any sense what the hell is going on, and somehow it works. You know, so it's sort of like.
I think the sports agencies are coming around a little bit. I've still seen some conflicting things from the NFL, but there are lots of even active NFL players that are openly advocates even for the cannabis industry. I think, you know, NBA, baseball are looking at that. UFC allows it. So a lot of the professional sport entities are coming around. I think cycling had a really bad run several years ago. So they may be really conservative for now. But I would guess in time that one will change because I don't know anybody that actually gets an enhancement from cannabis for a race.
Well, and I think also the quantitative testing is going to change everything. And I don't know how far we are from that. Stacy probably has a better grasp on that than I do, but it's definitely coming. It's just, I think, a matter of timing.
The other question I get often from athletes with CBD or CBDa is, well, am I going to get stoned if I take the product? So what are your, doctor, let's hear your thoughts, Dr. Kogan.
Yeah, that's a good one. I mean, in theory, right, any cannabinoid can have some psychoactivity, and I do occasionally hear from some of my patients who take large doses of CBD that they feel something, but it's dramatically different. It's not really a sense of being stoned or high or anything like that. It's just a somewhat slight shift in awareness or perception. But I actually have not heard from any of my patients taking any CBDA, pure CBDA products. So I think CBD may have a touch of it, but in reality, it's not really, it's the THC that has the psychoactivity primarily. And, what's interesting is, can you take enough CBD or CBDA to completely block the THC? So like, let's say you're taking the THC, but you no longer like the high and you just want to stop it. I don't think it's actually that simple. The CBD will definitely decrease, and CBDA may decrease some side effects of THC, but I don't think it will sort of stop the high. So, THC does what it does, and then, there you could, combining this, you could help some of the unwanted side effects, whether it's a dry mouth or even, paranoia and the sort of severe anxiety that sometimes occurs with THC. Both CBD and I think also CBDA can help with.
It's just taking our CBDA, we won't get high. What I have seen in really high doses, and we did a test, is it has such a calming effect that people are like, oh wow, I feel. And it's harder to articulate. It's definitely not a high, but I think all of us, especially the last year, carry more anxiety than we even realize. And so when you calm that down, there is a like, oh, wow, my brain does feel different. I'm less anxious than I was, or there's, like I said, this calming effect, but it's not the same high. And even THCA doesn't cause the psychoactive effects.
I would add that each person has kind of a unique, I hate the word psychoactive. It's very vague. It just, what Stacy said is so accurate. I mean, it's a calming effect. Most people will say it's a calming effect, but some people wouldn't like it. Some people feel like they're more depressed and down from it. And so I like to tell to my patients, each one of us have as Ethan Russo would put it, you got your own special cannabinoid deficiency. It's your deficiency, not my deficiency. So like, somebody's maybe more THC deficient. I mean, that's not true, right? But that helps us to think through how we respond to each cannabinoid. And so I think it's just a matter of learning how you respond to each cannabinoid in a way. But, you're not going to get high from any dose of CBDA. You could get so calmed, quote unquote, that it'll be a little hard to you'll want to rest and just not do things, but it's not really altering. And I think the doses for that, Stacy, would need to be massive. And most people will never get to such doses where they'll feel like that.
So can I get addicted to CBDA?
No. I get asked all the time by every student, by every faculty member, anytime I teach, all cannabis or any THC, the addiction potential is somewhere around 10%. It's sort of around in the same line with caffeine and nicotine. We think of it as something horrible, but I mean, you don't think 10 times when you have your cup of coffee in the morning in that sense, right? But it's only the THC that has that. Neither CBD or CBDA have. And frankly, I've probably at this point recommended cannabinoids to upwards of 3,000 patients. I haven't had a single patient come back and say, I have an addiction now. And a lot of these patients are on THC. When you use it medically and you use it in the right process, and you don't overdose, you don't escalate the dosing, you maintain the symptom control, I think addiction potential is not even close to 10%. I would venture to say it's probably less than 1%. It's probably safer than, in that sense, that any other prescription I write in terms of addiction potential. Like, I write benzodiazepines, for example. I mean, well, those that have a real significant risk. But even the pain medications that are not opiates, like Tylenol or Motrin, in essence, you can say that there is a dependence component. If your patient keeps taking it for pain, Okay, well, in that sense, sure, we can be dependent to anything and everything, but it's really kind of an irrelevant point.
I know I'm addicted to coffee. If I don't have my coffee in the morning, I'm not a good person to be around. So that's there. Um, we've talked about a lot of the benefits of CBDA. Are there any side effects that we need to be concerned about with CBDA? Anything that we should tell my athletes, should they take it with food, without food, at night, in the morning? Because some prescribed drugs, they say take with food, or some say don't take with other medications. What should athletes be concerned about if they're going to start on a CBDA regimen?
Well, I think I have not seen any real concerns in terms of major side effects. I would say that the certain patients who are extremely sensitive can have a certain minor psychological shifts. I have seen patients with mild anxiety, so sort of the opposite of what you expect, which is a calming effect. But that's true for any substance that can have at least theoretical, even minor psychoactivity. Could be what's called a paradoxical reaction. I think the most common is this kind of a sense of tiredness and fatigability. If you're sort of so calm that quite often it's actually not a true side effect. I mean, it's actually a good thing because they're just so hyper driven that they're not, oh my God, I'm actually exhausted, but I'm driving myself nuts. I'm in Washington, DC, right? So my common patient is a type A personality lawyer that hasn't rested for two centuries. So they finally get to a state of deep relaxation. They're like, I can't function like this. Well, of course you can't, because you got to, give your body. So, I mean, there's definitely certain shifts like this. I had some patients complain over some sleep disruption at the high doses, but those are pretty uncommon. I usually tell to everybody, I don't tell that there's going to be any side effect. And then I say, look, if you feel something, just call me. But I would say it's exceedingly rare. And I don't know, Stacy, what other providers tell you?
Yeah, I really haven't heard of any. Kind of what you said, some people feel tired, and it's like, well, maybe you needed to rest and you're coming down off your caffeine. But no, I don't really see any. In fact, most medications have the side effect of like nausea, diarrhea, all this like GI stuff, and actually CBDA kind of the opposite. It's anti-nausea, and the calming effect is good on the gut. So
yeah,
really haven't seen any side effects.
Yeah, I would add that, I mean, the allergies, everybody concerned about allergies to cannabinoids. I think though they are real. I have seen maybe 3 patients by now out of the 3,000 roughly that I mentioned. They're not very uncommon. And I actually know that at least in one of those patients, the reaction was not to the cannabinoid, it was to the filler or to the, like a coconut oil actually in the substance.
Yeah.
So we also have to be careful when somebody's claimed to be allergic to something. Are they allergic to cannabinoid, or are they allergic to other substance that's present as a part of the manufacturing process?
Right. We have a young patient who's been taking it and has had her mother reported it was the first time in 11 years that she said, I have no pain after taking our CBDA, which was a huge compliment. And then she had developed a coconut allergy. So we're making hers in a safflower oil now to avoid that allergy. So
for CBDA, what is the dosing? How much and how often should an athlete be taking CBDA?
Yeah, that's a probably most important practical question. Usually I would start patients somewhere between 10 to 20 milligrams twice a day. That would probably be the sort of a most common dose. I think, Stacy can talk to sort of about exact formulations that you guys have, but I think that's probably also what's consistent in the literature. If the patient is very sensitive, I may start at 5 twice a day, but usually I, go up, and you can go up pretty quickly and target to the range that's appropriate. And usually I advocate to start most of the time with sublingual. if you want a systemic effect, because I find that capsules are a lot less predictable. Some patients can have a pretty decent absorption that probably comes close to sublingual, but some people can have a massive difference. And so sublingual absorption is more predictable. It's also a little better. It's not dramatically better, but it's better. And I think that does make a difference also.
CBDA is more potent than CBD, so you could have smaller doses. But like you said, you can go up really quickly. And we've also had people who've been on CBD for years and switching to the CBDA, it's different receptors and it's a little different mechanism of action. So they may see a difference with the soft gels, which I think is Chris's favorite. We did a 20 milligram sort of dose. So even though it is an oral absorption, it does have first pass effect. We made them in a kind of a smaller dose, and then it enables people to take more if they want. So I tell people start with 1, but you may find that 2 works better, or 2 twice a day even, but you could easily take, what would you say is a max dose? Like 100 milligrams is like a decent dose, but I take more than that.
I don't think that's one area where I think the max dose is not concerning to me. I am concerned with maximum doses of CBD. I don't allow my patients to take more than 100 milligrams a day until they talk to me, and then we're sort of careful about this. With CBDA, I don't have that concern. So if they want to keep escalating the dose because it's working, that's fine. But usually you don't want to escalate to no end because of the cost, of course. So I tell usually to people, don't sort of, if you feel better, that doesn't mean that the higher dose is going to be better. Right. It's a sort of, you want to stick to the minimum effective dose. I think it's true for all cannabinoids, actually.
I take 2 of the soft gels in the morning and 2 in the afternoon. And I have an old injury where I broke my femur pretty bad in the distal portion, broke the patella. And so I've got to take it. It just helps with the pain and if not, pretty much incapacitated because of that. So I'm up about, I think that's about 80 milligrams a day of CBDA, and I haven't felt any side effect. I feel the effect of the pain relief. And so I'm very thankful. Thank you, Stacy.
Thank you. And you still ride your bike every single day, right?
Just about. Sometimes if it's a little too snowy or cold, I may not get out. But, last year I put in over 8,000 miles in the year. So I'm still pretty active. At 60, that's not too bad. So
that's more than some people drive. That's impressive.
Yeah, he's a rock star.
Well, listen, this was wonderful. Dr. Kogan, anything, or Stacy, anything you all want to add before we close out?
Yeah, I will add my sort of a future forward thought process. I think the cannabinoids are going to be its own field of medicine in the next couple of decades. So, and I see a CBDA future there is very bright. I personally think that we're going to pursue a couple of really fascinating directions with CBDA. One is the neurodegenerative diseases. I've been sort of playing around, trying different versions and combinations of CBDA with other cannabinoids for Alzheimer's disease. And I can speak to that outside of the fact to say that we are planning a formal research, but there's something really fascinating there. It's just a matter of several groups and researchers kind of figuring out how do they play, and how do we move forward with that. But I'm quite excited about this whole field because it's I'm not anti-pharma by any stretch, but this is, I think, where pharma never gonna catch up in a sense. They'll do what they'll do. They'll catch a corner and they'll do certain good things, but I think this kind of artesian market of a plant-based extracts is going to remain, because I think the value of it is so massive that it's going to be hard to sort of make something very similar purely pharmaceutical. Of course, they will try because of the FDA approval and the money involved, but nonetheless, for my patients, I know I'll still have access to products like Planetary. So.
Yeah, it's exciting to see where the industry goes. I think we will all get a bit of relief when there's some FDA guidelines, because for consumer protection reasons, it has been really interesting to find out what is out there in the market. So we've taken, like, in the absence of government restrictions, we have our own kind of self-regulations document. So at Planetary, the way we process is environmentally clean. We don't use flammables. It's healthier to our customers. It's healthier to our team, our family of employees that are, working in this every day. We're big on what's better for people, for the planet, and for the plant, and now pets too. And then we do philanthropic efforts. So we're committed to. We have a program where we give discounts for those who medically need. And that's important to me because I want to make sure, like, this is a high quality but a valuable plant, and we want to make sure that it's accessible to those who really need it. I'm grateful to providers like Dr. Kogan because that's very forward thinking. I came from a medical background, and not that many medical providers are trained in this, and certainly not to your extent. And so a lot don't think to go to a plant for medicine, unfortunately. We're just going to chemical pharmaceuticals. So I really look forward to the day where we're all looking more towards plant medicines.
Fantastic. Well, I got to say, I learned an awful lot today, and thank you, Stacy Kaysen. Thank you, Dr. Kogan. I'm going to pass all this on to my. Thank you.
Thank you. Thank you both.
We should do it again.
Yeah, let's do it.
Bye-bye.
Bye.
Bye, everybody.